So they have to sort of make that call right on the spot on a regular basis.
Exactly. I mean, the thing is we have seconds on making decisions, where in litigation, attorney has months or year to argue what we did.
Yeah, that's a pretty interesting and probably stressful situation. And that was one of the things I wanted to ask you about. With how much stress does these kind of decisions put on that officer?
Well, we all know everybody has a different stress level, and to a law enforcement, and that's not just a deputy, but that's any police officer. It's very high, because what happens is you're constantly going up and down on your stress. You know, if you was in a standardized environment, your stress will come and even out on a plateau. Well, a police officer, it goes up and down. You're going to be at 100, you know, the speed is up here, and then you're back down, you're up. And that is the issue that causes a lot of problem with officers.
Yeah, I would imagine that would be the case, having that sort of adrenaline rush because something's happening and you have to just move right now, and then other times calm.
Right.
That would be pretty stressful, I think, for anybody. So, and my hat's off to all of them. I'd like to go into something else. That, you know, we're facing an opioid situation nationwide, including Belmont County. And I wonder if you could just kind of let us know how this opioid situation affects the officers. The kind of stuff they have to deal with has to be pretty stressful sometimes.
Well, the thing is these days in Belmont County, across the river, tri-state, and all over, is the opioid problem is at the highest. We have to take a lot of precautions, and I have outfitted our deputies and patrol units with equipment and safety gear, because not only we know the heroin and the overdose, we had 3 overdoses today alone in Belmont County.
Opioid or heroin?
Yes,
or
yeah.
Opioid?
And so we have to do, because now not only have to worry about heroin and cocaine and meth, now we got to worry about the fentanyl, and now the carfentanil. And we've already had many cases in Belmont County where fentanyl has been involved. And you're looking, you know, fentanyl compared to heroin is like 100 times worse. And then you get into carfentanil, you know, it's like 1,000 times worse. So and these are synthetic drugs.
Wow. So, you know, we think about the heroin problem, 1,000 times more powerful than heroin. That's almost mind-boggling.
Well, and like I said, and you know, anybody can get on the web and look that up, and you can just see, like the fentanyl, it'll just take a few grains of fentanyl for someone to OD on. Now the carfentanil is 2 or 3 grains that will overdose someone.
When you say grains,
Like
I've read
salt.
that means like grains of salt, right?
Exactly.
So you're talking about 3 or 4 grains of salt is the amount.
Yeah.
That could be in anything.
Right. And what we're running into is they're lacing their product out there with fentanyl and carfentanil. Because once you take it, you're addicted. And that's what they want, because once they get you addicted, you're going to keep coming back. I mean, the ones that gets addicted, they give up everything in their life for the next fix.
Oh, I can imagine that you know some pretty wild stories about what people have done. Can you kind of share with us, without giving any names, something that you've seen that's
Well, what's really sad is that because where the epidemic is it's almost all family will know someone in their family tree that possibly is maybe not on heroin and stuff, but it could be prescription, that they've been on pain pill or the other product and they're addicted to it. So we all see it, and we've seen to where, you know, mothers and fathers have given up their kids and totally went from, you know, what you call, I say not a picture perfect family, but a very good family unit, to where they threw all that away and they would steal from their family, from their kids, and from their parents to get their next fix.
So I think that's one of the most disgusting parts of this, that it's such a powerful drug that people will steal from anybody, grandma, mom, dad, their brother, sister, best friend, doesn't matter.
And that's where everything snowballs off of that in regards to crime, is because the people who are addicted, they're out there doing crimes and to make money because they can't keep a job, so they can buy their next fix. So, you know, the thefts and the burglaries and the robberies and this and that, you know, goes up because they need that next fix.
So your people are responding to a lot of crime being committed by people who are on drugs trying to pay for it.
Good
Burglaries,
possibility.
robberies, and that sort of thing. Yeah.
I would say a large percent of our people in our jail population is related to drug and alcohol. We're on our second year, we have Southeast and Crossroads that works full-time in our jail. Full-time staff in our jail. So when someone is arrested and brought in, we're able to offer them and give them treatment as soon as they are arrested.
Wow. So these when the officer goes out, if they find somebody who's under the influence, is that how they catch them, or do they catch them in a crime? Or
well, it's a lot of different things. It could be domestic related. It could be a fight. It could be a theft or anything, or a traffic stop. You know, we have the major crime units of Belmont County. All the law enforcement community are members of it, and we're out there working, fighting this epidemic. You know, I also have 3 full-time deputies that is working criminal interdiction, that they assigned. They're going out there and stopping the cars, and the thing is, and taking the drugs off the street. So everybody in Belmont County in the law enforcement bill, we're working at it, and I'm telling you, we're not winning the battle.
yeah, that was my next question. Is how, it's an enormous problem. I mean, that's obvious. So what do you think the chances are of getting a handle on this? Do you have any ideas of how that might happen?
Well, what's going to, my thing, and there's been a discussion before, for us in Belmont County, and no disrespect, you know, I'm an elected official by everybody in Belmont County. My responsible Belmont County. And as hard as we're working, and everybody out there knows, every police agency, our office, the prosecuting attorney Dan Fry, and the committee, we're all working toward it. But what it's going to take a full-time drug unit. So we're working around the clock full to get a hold of this in Belmont County. I mean, we're doing it, because I have a bigger agency, I'm county, and I got a bigger budget than the villages and the cities. I'm able to do more. But we need to do more whole. This is just not Belmont County's, sheriff's office. This is every village, every township, and every city in Belmont County, our problem. It's Belmont County.
Yeah.
And the way to get a handle on it, we need a full-time drug investigative unit to work at it full-time.
That's it. That's all they would do.
Yep.
That probably makes sense. The size of this problem. I mean, because I don't know that many people think about it, but this drug problem is on top of your normal every other problem.
Oh yeah.
So this really added to the load. But I got one more question in that vein. Is somebody, one of your officers has to answer a domestic problem. Does that seem a little more risky now that you don't know what the heck you're going to be walking into?
Well, the biggest thing is because of the epidemic, it is unbelievable the amount, and you know, we don't go to the houses for a cup of coffee and a piece of pie. We go to the call because there's a problem, and so there's always underlying issues why the problem happened: drug, alcohol. So if it's drug related, it's unbelievable the needles that we come across and stuff like that. So, and my officers, we carry Narcan, and we carry an allotment, you know, on each officer because not only for the people out there, is for the officer that if they could get contaminated, especially on the fentanyl or carfentanil, it might take several, 3-4 hits of that to bring someone back around.
To revive them. And that's the other risk, is the officer may run into this drug and get it on them and cause them problems. I mean, I've heard of officers getting sick with this.
Yes, and like I said, and when it started coming around here, you know, the one officer up here north of the river got it, and he did everything at the scene properly, gloved up and everything. But when he got back to the office, he brushed something off, and it was that, and he overdosed. And
wow, just from brushing off something that was on his,
yes.
on his, that's got to be pretty frightening.
Well, and like I said, and I've outfitted all my officers for that. For every patrol officer has a kit to where they could suit up to protect themselves. But not only on a local level, state level, they have to change the whole gamut of the evidence process of double bagging and all this and that. Like, we don't do no more field testing out in the field because it's too dangerous for the officer.
That's saying a lot, isn't it?
Yes.
That's just, I think when I think of the officers and his safety, I think that's another burden on that officer's safety.
Right.
A big
It
one.
is.
And it's almost invisible. I mean, that's pretty frightening to me. I'm going to switch gears here a little bit on what you might think that someone who has a loved one who might be hooked on one of these drugs and not know what to do. Do you have any advice on what they should try to do?
Well, the thing is, and like I said, I'm not the expert, and truthfully, I'm on the law enforcement side, and our thing is get out there to get the drugs and get it off the street and stuff like that. But like I said, we also got it inside our jail. But there's a lot of things in the valley. You know, we have Crossroads here, and I think through Crossroad they have awakenings. Then you got Northwood and Southeast, and you know, you got over in here Miracle Happens, and there's another which is a recovery home. It's WIN, and that stands for Women Inspired in a New Direction. And there's a lot of help out there. They just got to ask for it. Southeast. Also on the mental health side of it or whatever like that. Your church is a big outpour. I mean, a lot of people don't want to admit that they have a problem.
Okay, that's what I was alluding to. Is how do they get around?
Well,
this
the thing
idea
is this is where friends and family knows who has a problem. I mean, you do, you do, and it takes the friends and family, and like I said, maybe the church or whatever, to give them some guidance to get them into treatment in the right direction to get help. Because, like I said, a lot of they can't do it on themselves. They need a support group and structure so they keep their mindset. And we all know and look at it is, unless we convince the person it's a downhill battle. They're fighting themselves.
Yeah.
And so there's a lot of organizations out there. You can get online, like drugabuse.com. You can get online and read that, and it'll really explain to you and help you and guide you what you could do to help someone who has an addiction.
Drugabuse.com, that would probably be a good place to go. I have just basically one more question, and that would be, is there anything else you would like to add or tell us about?
Well, like I said, that it's been a battle, been a struggle, and I will tell you and tell the people of Belmont County, we're not giving up. We're fighting every day, tooth and nail. My staff, and I know the other police agency has good people, and like now they make me look good. I mean, I did all my tour. I mean, back in the 80s, 1981, I came over to the sheriff's office. I might have been the only one working the whole Belmont County in a patrol car. So we came a long way. My officers at the office now are totally professional, and they take their job serious. And I know, and there's times, and I tell them, I know I'm tough, but it's my job. That's why I elected to motivate them to go out there, and they're doing, because people see it. They know, they see the cars, they see the arrests, and one thing I think it's a big accomplishment is that all law enforcement agency in Belmont County is working together. Not only the sheriff's office, all the police department, the state highway patrol. I mean, we have a very good working relationship. We meet monthly. We had a chief's meeting today. So we partner up with the chief over in Wheeling. We have meetings on each side, and we host a regional meeting. So we have the communication and the working force that I've never seen before. So we have that for our plus.
Well, I think that's important that you let us know that, because people know that there's a lot going on they don't see.
Yes.
And it sounds like you're doing a great job. And I'm going to say thank you very much for coming in and explaining all of this to us.
Well, it's a pleasure, and it does mean a lot. It was kind of like my dream coming up through the ranks, and I do take my position as sheriff very seriously.
Well, that I know for a fact, and thank you very much.
Okay. Thank you. You're welcome.
I appreciate it. Belmont County Sheriff Dave Lucas, and we will be right back.
Video and media technology have changed dramatically over the years. At ESV Teleproductions, we have the knowledge and the latest equipment to complete your project that will be a cut above the rest. The next time you need media produced, call the award-winning professionals in St. Clairsville, Enchanted Sound and Video, ESV Teleproductions, 740-695-5289.
Drug use in the country has reached epidemic proportions. It affects each and every one of us on a daily basis. Every day there are news stories of appalling behavior and tragedy. In this next segment, Judge Costine will try to help us understand what is going on and what can be done about it.
A good evening planned for you here with information about the opioid problem here in Belmont County. We heard from Belmont County Sheriff Dave Lucas, who gave us a lot of information, and now we have Shannon Watson, Executive Director from Crossroads here. Shannon, welcome.
Good to meet you.
I'm so
Thanks
glad
for
you
having
stopped to
me.
see us.
Oh, it's my pleasure.
I'm really happy about this, and I have a lot to ask you about, but most important, I think we want to know what is Crossroads?
Crossroads is a substance abuse and addiction treatment center. We're located in 3 counties. We have an office in Monroe County. We have 2 offices in Belmont County, 3 offices in Belmont County, and we have an office in Harrison County. So we serve the Tri-County area. We are a comprehensive substance use and addiction treatment center. We offer services for people who are mildly addicted all the way up to inpatient residential centers for those who need and require more intensive treatment.
So is there an office in each of those counties?
Yes.
Well,
Yes.
that's kind of neat. They know where to.
Yeah,
how
we
to
have
find
5
that.
outpatient offices.
Well, that's really excellent, because I think that's one of the things that we hear from people is they don't know what to do. Family members, and they say, well,
Absolutely.
they have maybe a member who's got a problem. They don't know where to go or what to do, and nothing happens. So I think it's important what you're doing here. I think we need to let people know where these places located. You have.
So in Belmont County, we have an office in Bel Air in the Chase Building. Here in St. Clairsville, we're right across from the post office on Main Street, an old red brick building. We've been there for years and years. We have an office location in Barnesville Hospital in the professional building behind Barnesville Hospital. We are located in Woodsfield in Monroe County, and then in Caddis and Harrison County.
Well, that's really helpful, because the problem is in all those areas.
Absolutely.
And is there any particular area that's you're seeing more people coming to you than in others?
You know,
or are they all the same?
No, actually, I think there's a lot of the idea out there that one area is more affected by the drug problem than another. Even here in Belmont County, you know, you hear a lot about down, you know, in the river communities in Bel Air and Martins Ferry. What we have learned at Crossroads is that every area is affected as equally. You just don't hear about it as much. It's in the rural communities, it's in the farming communities, it's in the cities. There is no socioeconomic boundary. We have professionals in our agency who are undergoing substance abuse treatment. We have all walks of life, men, women, elderly. I think the oldest right now we have is 84 who's in treatment with us. So there's a lot of ideas out there about addiction and substance use that, you know, people kind of associate from the past and how addiction was in the past. But what we're finding is this is a brand new game. In the last 3-4 years, the game has changed.
A lot in
absolutely,
recent years, yeah.
Absolutely.
I know it's becoming such a problem that the general public is becoming aware of it, and I think a few years back, the people were not that aware. We had it.
It was hidden.
It wasn't that problem this big then.
Right.
Is there any particular drug of choice that you deal with, or,
you know,
is it alcohol? Or
you hear a lot about the opioid epidemic. It's a buzzword. It's a catchphrase. The politicians love to talk about the opioid epidemic, and I think the reason that people talk about the opioid epidemic is because it kills immediately. You know, overdoses, like Sheriff Lucas said, we see 3 today. We were aware of those 3. So you know, I think a lot of people concentrate on the opioids and the prescriptions, but really, in Belmont County, the drug of choice is cocaine. In Monroe County, the drug of choice is meth. And in Harrison, it's alcohol is our number 1. We keep statistics on all of this so we can track what's coming and going and what's, you know, coming up and going down. I think that our clients are aware of the danger of opioids and of the fentanyl and carfentanil that is out there. So they are steering away from that. What's shocking to me is how acceptable cocaine has become. When you talk to someone who's a cocaine addict, in their mind, it's like smoking a cigarette. It's not, for them, they'll say, well, I do cocaine, but that's no big deal. And yes, that is a huge deal. So yeah, it's kind of a misnomer. Absolutely.
It is, because I happen to have seen people who destroyed their life with cocaine.
Absolutely.
I mean, literally destroyed their life, their family,
Absolutely.
Everything with cocaine.
With cocaine.
That's not a very good thing. Why would someone come to Crossroads?
So there's a lot of different ways to get involved in treatment. One of them you just heard about was Sheriff Lucas. We do work closely with law enforcement. We are not an extension of the court. We do run the adult drug court program here in Belmont County. How we view our interaction with the justice system is sometimes it takes getting them getting into trouble to get them to us to get into treatment. So we see the justice system as a gateway into treatment. Once they get into our hand, get into our hands and get into us, they are clients. So the criminality is not an issue when they come to us. So we work with getting their legal issues taken care of, but the most important thing is getting their disease, which is addiction, under control.
How about the success rate? How often do you turn people around?
So the success rate, again, there's a lot of misunderstanding. Obviously, our goal is to have everybody who walks in the door walk out abstinent, not using substances. I think a lot of people think that if a person relapses, it's failed. They went to treatment and they failed. How we view treatment and how we view success is, are they becoming more successful in their life? So obviously we never want a person to relapse, because that relapse could be their last when you're dealing with fentanyl or carfentanil especially. But the most important thing is get them back in the door, get them back into treatment. We never say, well, you failed a drug screen, so you're done. Get them back and increase their treatment. Give them a more intense treatment, sometimes up to the level of residential if need be. But the most important thing is get them to improve the quality of their life, their family's life, get them reunited with their children if they've lost their children. A lot of people are driving under suspended license, help them get their license back so they can get a job, so that they can get back to contributing to society. So, I don't want to say, it's not a personal thing when someone relapses. What we see is that's another opportunity for increased treatment. Yeah.
Well, I've noticed in my life that to be successful, it's dealing with anything, including drug addiction or giving up smoking or any of that, is to keep going back. If you fall down, keep getting up and going back. Eventually, you will win.
Absolutely.
You will not lose unless you stop going back.
Absolutely, absolutely. And that's what we try to instill in our clients is, if you slip, you are not a failure. If you slip, we're not going to turn you out on the street and say we're done with you. Come back and keep trying. The average person relapses 5 to 7 times before maintaining total abstinence. That's a long time.
That's an important piece of information for people to hear.
Absolutely.
Because that's what it takes, is you have to repeatedly do it. I used to be a snow skier, and in teaching me to ski and other people, that was the main thing they taught everybody, is if you're not falling down, you're not getting better. So get in there and keep going. If you get up, you'll become better. And so the mistakes were the way of teaching.
Absolutely.
And this is pretty much the same thing.
It is exactly. I always compare it to a diet. How often do you jump on a diet and you say, I'm going to eat healthy and I'm not going to eat a ho-ho and I'm not going to eat those snack cakes, and then, next couple of weeks there's a birthday and you have a piece of cake. Do you quit? Do you just give up and say, no? You get back on it and you try again and again and again, and eventually you will succeed.
I think that's probably the most important thing people should know, to be honest with you. I want to go one more thing with you, and that is anything else at all you'd like to share with us that I might not have touched on?
I think we touched a little bit on it, but I think that the most important thing that I really want the public to understand is that, the disease of addiction, that addiction truly is a disease. It's a relapsing, recurring, progressive disease. I always compare it to diabetes. It's something that, was it that person's choice to use the first time? Absolutely. But what happens in their brain is out of their control. The very same way a diabetic, was it their choice to eat the sugar and eat everything that kind of led them? Yes, but it's never too late to stop that path and turn around. If you don't get treatment, eventually this disease will kill you.
Yeah, well, that's a terrible thing, but it's the truth.
Absolutely.
And I think we need to know about that. Well, anyway, Shannon, thank you very much for
Thank
stopping
you.
by. I think you gave us a lot of information.
Well, I'm glad. Thank you for
That was,
having me.
We'll have to do this again sometime.
Absolutely,
Because this
anytime.
problem's going to be around a while, I would imagine.
I think so, unfortunately.
So we will see you next time, and I'll be back in just a minute or two, and I have something else for you on opioids. Thank you.
Video and media technology have changed dramatically over the years. At ESV Teleproductions, we have the knowledge and the latest equipment to complete your project that will be a cut above the rest. The next time you need media produced, call the award-winning professionals in St. Clairsville, Enchanted Sound and Video, ESV Teleproductions, 740-695-5289.
Welcome, and we have some more information for you. I think it was pretty interesting this evening to talk with the sheriff and to Shannon about some of the problems that people are facing with this drug problem in this county and around the United States. When I look at the numbers and do my own research, I was shocked to find out just how much of a problem it is. And being an inquisitive person, I wanted to find out how in the heck did we get here. As Shannon just noticed, the last few years there's been a massive change in what happened, and that is consistent with what I've discovered. We're going to show you a little quick PowerPoint presentation that I put together so that you can see the big picture of how did we get into this problem, and I think you're going to find that how it started is shocking, and the problem is still here. So if we can go to our slideshow, I'd like to start with pointing out that Medicaid expansion fueled the opioid crisis, and right now you're probably saying how that happened. Well, let's take a look at the next slide, and what we find is that much of the opioid addiction crisis started with prescription drugs through Medicaid. People got addicted to drugs in Medicaid, and then it crossed all socioeconomic groups. Now we'll move on to the next slide, and this one I want to go through to explain some of the things that happened here, how Medicaid expansion fueled the opioid crisis. First, government required a pain survey for Medicaid patients. Now, what that means is when somebody went to the hospital, they had to fill out a survey, and if they said, I didn't get treated for my pain enough, that hospital and doctor risk losing some of their Medicaid payment from the government, and Medicaid does not cover most of the cost already, so it was going to be even less. So you keep that in mind. Now, they also required Medicaid recipients to get prescription drugs at a reduced cost as little as $1 for 240 pills. So you have people who can go to the hospital, say my back hurts, get a prescription for $1 and get 240 pain pills. Patients became addicted to opioids and started selling cheap prescription drugs on the street. And as you can see, they have 240 pills for $1. They can sell them for a lot more. And I did some research myself, and I also found in that research that Senator Ron Johnson, Homeland Security and Government Affairs Committee Chair, uncovered a connection between opioid addiction and Medicaid expansion, which is exactly what I found. Government now requires doctors to reduce the number of doses prescribed, and some in government thinks that's an answer. Actually, it's not the answer. It was a good idea to cut down how much of this is going out there, but the problem is already in place. Once you get the market set up with people addicted, you can cut down on the prescriptions because they can go elsewhere. And that's what's happened. Prescription drug addicted people turn to the street drugs like fentanyl and carfentanil and heroin, and the drug deaths hit the roof. And that's what the sheriff was talking to us about. Politicians now want to keep Medicaid expansion in order to treat opioid addiction that was created by Medicaid expansion. Now, that doesn't make any sense, but let's move on to the next slide and let me show you some of the things that we've learned about how this happened and what the results are. Ohio overdose deaths, 2012, 2013, 2014, and 2015, over those 4 years. If you look at the left, it'd be the right-hand side of your screen, no, the left side, I'm sorry, you'll see 75 people died of overdoses in 2012. This is in Ohio. In 2013, 84 people died. And previous years to that were those kind of numbers. Now, in 2014, you'll notice that 503 people died of drug overdoses. That is the exact year that Medicaid expansion was implemented in Ohio. And then you look at the next year and you see 1,155 people are now dead because of this. And that's just in 2 years of Medicaid expansion being in place. Well, how did that happen? The number of people on Medicaid expanded with Medicaid expansion. Let's go to the next slide. What we found is West Virginia did a great study, and it has a high death rate like Ohio does. 725 people died in West Virginia overdoses in 2015 alone. West Virginia Department of Health and Human Services analyzed every overdose death in the state in 2016. And what they found is very disturbing. 3 out of 4 people who died of an overdose had been on Medicaid at some point in the year before they died. That's 75%. 71% had been on Medicaid in the 12 months prior to their death. 67% had Medicaid for at least the entire year before their death, and 81% of the women who passed away from overdoses had been on Medicaid that year. Now, those are solid research results from the state of West Virginia, and that is about real people. So you have 725 people died, and look at what the big percentage of that is came off of Medicaid and Medicaid expansion. Now we'll move on to the next slide with a little more information about prescription drugs. They created a cheap drug market. And this was kind of complicated, but during the Obama administration, they required that states charge Medicaid recipients only $4 for certain classes of drugs, and for dangerous and popular opioids such as OxyContin, Medicaid copays ran as low as $1 for 240 pills. Now, if you take those pills out in the street and sell them, that same amount of pills can bring $4,000 or more. So make yourself somebody who's living in the street or somebody who's been added to Medicaid expansion. You can make $4,000 by spending $1, and the American public, the taxpayers, paid for those drugs, and they put them in the street. So we've created a big market where there's money to be made now. This is why I believe in 2014, when Medicaid expansion took place and took off, this is what it did. It handed a Medicaid card to a lot of really bad people, and they went out and used it, and we now have a price crisis that is so huge that the entire country is in flames with it. It fueled cheap prescription drugs. Opioid death spread to every socioeconomic group in the United States. If we don't know the beginning of how this started, we will not know how to fix it. Now we're going to move on to the next slide. Medicaid spending on able-bodied adults has increased by more than 700%. That's as a result of Medicaid expansion. Since 2000, able-bodied working-age adults, including Obamacare, has gone up 309%. That is an enormous number of people. Since 2000, spending on able-bodied working-age adults has increased from just $19 billion to nearly $158 billion. That's an increase of 700%. It is unimaginable. Centers for Medicaid and Medicare Services estimate that taxpayers will spend more than $632 billion on Medicaid alone this year. That's more than triple the $206 billion back in 2000. Now, Just to give you an example of how much money that is, that's enough money to build the entire wall on the southern border, and you still have over $600 million left. So we're talking about an enormous amount of money. Now we're going to move on to the final slide. And this is some of the results that the Committee on Homeland Security and Government Affairs conclusions came up with. Since 2010, at least 1,072 people were convicted for improperly using Medicaid to obtain prescription drugs, and some were resold on the nation's streets. The number of criminal defendants increased 18% in the 4 years after Medicaid expanded, that's 2014 to 2017, compared to the 4 years of before Medicaid expansion. So this is consistent with what we've heard here this evening. More than 80% of the 298 separate Medicaid opioid cases identified were filed in Medicaid expansion states. Now this is really interesting. That's led by New York, Michigan, Louisiana, New Jersey, and right here in Ohio, who also expanded Medicaid. The number of criminal cases increased 55% in the first 4 years of Medicaid expansion. Let me repeat that. The number of criminal cases increased 55% in the first 4 years of Medicaid expansion from 2014 to 2017 compared to the 4-year period prior to that. And we talked about that a little bit with the sheriff. Other preliminary data suggests that a connection between Medicaid expansion and opioid abuse, drug overdose deaths on a 1 per million people, 1 million people, are rising nearly twice as fast in expansion states as in non-expansion states, while opioid-related hospital stays paid for by Medicaid is also spiked and going wild. So you see the difference. Now I have one more for you, that a recent report, we're going to go back to the number 1 slide, if you can do that for us. A recent report from State Auditor Dave Yost in Ohio says that Ohio Medicaid recipients with an opioid-related diagnosis grew 430% over 7 years. That's climbing from 6,500 in 2010 to 48,000 in 2016. So that's a little slide presentation I wanted to make so that you can understand the numbers. It's absolutely unbelievable, the number of people who are addicted to drugs, and we can trace it right back to a number of studies, including federal government, state government, my own research, and the stuff that we've heard here tonight from various guests shows that Medicaid expansion is central to this issue. And one of the concerns I have with this is I'm hearing politicians saying that they're going to keep Medicaid expansion even though it's been an utter and absolute failure in every way. They want to keep it in place, and their excuse is to fight the opioid problem. That is one of the most ridiculous things I've ever heard any politician say, and I've heard a lot. To keep the problem that started the problem as a means of fixing the problem. There are words to describe people who think like that, but I won't use them on over the air. But it's absurd. We have to find a way to go back to get our representatives to understand they need to go back to where this started, the Medicaid expansion 2014, and understand that you can't give this big population of people who are already at the most risk of problems. And this is something we also may not have been, it wasn't shared with us, but prior to this, Medicaid has always been a problem for drug abuse. And so what we did was took a population that already had a problem of drug abuse and gave them a drug card, a Medicaid card. We expanded it. We gave them more. We added more people into that situation. So I'm trying to tell you that I think that we need to talk to these politicians who are telling you about expanding Medicaid, keeping Medicaid expansion in place because of all the reasons they give you, and tell them that they're the ones who created this mess. If you expanded Medicaid, some of this sits at your doorstep. And the evidence is overwhelming that that's what happened. My hope is that our representatives will take time to look in a mirror and ask themselves where do they want to be with this. Do they want to be a part of the solution, or do they want to continue the problem? And with that, I'm going to have to say we've had a great evening tonight. I'd like to thank you for coming in. We'll do it again next time. I'm Bob Connors. Have yourself a great evening.